All right. Well, hello, everyone. We're going to go through just a quick overview of just intro on methods. And I wanted to just run through this lecture with you guys really quickly for material that we've had in class. So the vast majority of research papers that we read, right, all follow a method known as the Mrad method. And Mrad stands for Introduction, Methods, Results, and Discussion. So that is the most common method that we typically see, particularly when reading the typical paper, right? So generally speaking, when we look at the introduction of methods, we need to really think about the following ideas, right? Why did the authors conduct the study in the first place? What was their reason or purpose for that? How did they conduct the study and how did they analyze the data, right? And so that obviously the question really centers around first the introduction, and then the methods. So a well-performed study should really propose a novel research question or purpose, or study an existing research question in a new context. And those are both really, really important factors when looking at a research paper. So there's a great book that I referenced for this lecture, and it's called How to Read a Research Paper by Tricia Greenhall. And her question, she essentially says that as readers of research papers, we should be able to decide whether or not a study is a good study based solely on the introduction and methods sections of the paper, right? And so in order to help us answer that question, she proposes 3 questions that we need to answer. The first one is, what was the research question and why was the study needed? The second one being, what was the research design? And then thirdly, was the research design appropriate to the question? So before we really start, kind of trashing a paper, so to speak, right? Before we decide, whether or not a paper is good, generally speaking, as a part of the publication process, there is such a thing known as the peer review process. And this happens with people that publish papers, with papers that I've published, typically go through a peer review process, right? So a peer review process where members of a profession or organization who are trained or have experience within, a specific field. For example, athletic training. I'm a journal reviewer for a couple of different journals within the discipline. And so our job when we review a paper is to really decide, first of all, is this paper valid? If it is a study that is experimental or quantitative in nature, is it measuring what it's supposed to measure, right? Is it original? Is it something that's been done before? Is it going to, essentially add new knowledge to the profession or no? And then obviously is it important, right? So, is it something that, does the question itself hold relative importance to the profession or to the discipline as a whole? Will it create new knowledge? So when I submitted a paper as an author, one of my first one actually, I got, the peer reviewers that reviewed my paper ultimately suggested that I resubmit with revisions because there were certain parts of it that they felt were too lengthy, or maybe that they were, potentially needed more context. So I had to go back and make revisions, and then I resubmitted and it got accepted. But the peer review process typically results in one of 3 decisions. Either acceptance of the manuscript, resubmission with revisions, or rejection. And this is extremely common with this process. It's also extremely common to have to resubmit at least once or more. So what are some reasons why these papers get rejected, right? Ultimately, maybe that, it lacks importance. It didn't really address a scientific issue that's important to the profession or the discipline. The study, maybe it wasn't original. Maybe somebody's already done the study before in another journal. Maybe the author didn't test their hypothesis. Maybe they didn't design the study correctly, right? Maybe there were confounding factors and practical difficulties that led to the data being essentially corrupted and or being really very difficult to interpret because of factors that were not well controlled, right? An example of that, a very simple example of that, would be testing strength. Let's just say testing one rep max strength between collegiate football players and between power lifters. But what if we didn't control for something like anabolic steroid use, right? I know that that sounds like it would, obviously that's unethical, and in today's world, there are tight controls around those types of things, particularly around performance enhancing substances. However, if one of those groups, right, was found to be using performance enhancing substances, that would essentially affect the outcome of our study. It would make our data, invalid and not reliable, right? Maybe we studied too small of a sample size. Maybe the sample size that we studied was so small that our results are not generalizable to a broader population, right? Maybe there was no control group. And we'll get into that when we talk about validity kind of in a deeper way later on in the course, right? Maybe the data were analyzed with the inappropriate statistical method, right? And or maybe their conclusions were not justified. Maybe there was a conflict of interest, or maybe the paper was just badly written. So there are many number of reasons for rejection, but it's the responsibility of the peer reviewers to specify the reason why that paper was rejected. So generally with an introduction, there's no heading, or there's no heading after the heading at the beginning that says introduction, right? So typically what we're concerned about with the introduction is setting the context for the study, establishing what we already know and what the study seeks to add. Obviously, summarizing whole studies is not, entirely necessary, but utilizing maybe averages and, within statistics can be extremely valuable in reporting data about what's already been done within a given topic. The introduction typically concludes with a purpose statement and often a stated hypothesis. So going back to Tricia Greenhall's questions, what was the research question and why was the study conducted, right? So the research question is generally defined or identified as a result of reviewing literature and establishing why the research question is needed in the first place because of what's been done in the past, right? So citation of studies that are similar to yours can be beneficial in the literature in order to kind of set the context for what's been done previously by different researchers. But the biggest thing is that we really need to be able to identify a gap in knowledge that your study will fill, right? That is the most important point. And in writing the introduction, you'll essentially identify that gap in writing prior to identifying your purpose and hypothesis. So the method section, right? What was the research study design? So the study, may be an experimental study, or it might be observational, like a randomized controlled trial, or maybe even a cohort study. So description of subjects is really, really important because this is useful in determining, not only the level of external validity within your study and the generalizability of the results, but it's also important for other people reading your study to determine how applicable it is to their specific problem, right? It's also very important to obviously point out things like informed consent within your study, and then also instrumentation as well. And the reliability and the validity of that instrumentation should be appropriately documented. So, all right. So the second question, or the third question rather, was the study design appropriate to the question? So there are many different types of designs. Obviously, as we've talked about, experimental designs involve the manipulation of an independent variable, which is a variable that's under control by the researcher to test the effect of it on a dependent variable or an outcome, right? So randomized controlled trials often randomize a specific treatment or group versus a control to observe the effects of that trial on a specific state. And so, for example, we also have cohort studies that follow tumor groups over time based on their exposure. These are generally prospective in nature, right? So it could be, looking at maybe exposure to a specific, chemical or environmental factor that could, be a kind of a precursor and or a risk factor for a certain type of disease. Case control studies typically involve comparison of one group to another in studying those who maybe have a disease or condition of interest compared to those who do not. These are typically retrospective in nature, meaning that we are taking data that already exists, whether that's patient encounters within a healthcare system or some other type of data, and looking backwards, right? And then cross-sectional surveys are another way to gain information on a problem at a specific point in time to be able to utilize that data to make generalizations or inferences about a given subject. So this is really, really amazing video. We're going to get into a paper here in just a second over about Nordic hamstring exercises and a specific study that comes from the Journal of Athletic Training. But I wanted to give you guys a quick overview of one of the pieces of equipment that's utilized actually in the study to give you a little bit more context. So go ahead and take a look at this video here if it will load. So this video essentially explains the NORD board, which was the apparatus or the instrumentation that was used in this study to essentially perform the Nordic hamstring exercise that we're going to discuss. And it was also was essentially calibrated to collect data within the study that we're about to review. So this link should be active in the PowerPoint that's posted on Moodle, so you should be able to click through this and take a peek at it. Okay, so we're going to review a study really quickly. And the title of the study comes from the Journal of Athletic Training, and it's different interset rest intervals during the Nordic hamstring exercise in young adult males, right? So this is done by Benjamin Jury and colleagues. And so the purpose of their study was to examine the effects of a short versus a long interset rest interval on measures during the Nordic hamstring exercise, right? And so they are essentially hypothesizing that based on lower levels of fatigue associated with eccentric muscle contractions, which is the lengthening of a muscle, not necessarily the shortening of it, right? That the length of an interset rest interval used for the Nordic hamstring exercise would not result in performance differences between sets. And so their methods, obviously, right? So they used a randomized repeated measures crossover design to assess the effect of different interset rest intervals on selected indices, including force, muscle asymmetry, and fatigue. And they randomized their subjects. The independent variable here was the interset rest interval. So that was the variable under control of the researcher. And the dependent variable here was force, muscle asymmetry, and fatigue. Okay, so ultimately here, what we need to really kind of take a look at in their method section, right, in order to determine the quality of the study, they should have a description of subjects here, which they do. So right at the top, it says subsequently the sample consisted of 10 young male team sport athletes. They give us a mean age with a standard deviation, right, and also height and mass. And it says, participants were physically active and undertaking 2 to 3 sessions of supervised resistance training and 3 to 5 sport-specific practices per week. So the one thing that's really important here that they do for us is they give us their inclusion and exclusion criteria. So given that previous hamstring injuries can influence indices such as force and asymmetries, we require participants to meet the following inclusion criteria: peak force eccentric hamstring score greater than 337 newtons during the Nordic hamstring exercise, right? Peak force asymmetry of less than 15% during the Nordic hamstring exercise, which they're calling the HE. So less than 15% asymmetry between the left and right side. That these people should participate in regular resistance training once per week, and know a little bit or have exposure about the NHE within their training, right? Now, the exclusion criteria. So no lower limb injury in the past 6 months. So that's the exclusion criteria, as well as any vigorous exercise or caffeine or alcohol consumption, or any like nutritional aids or anything like that. So any of those things would have disqualified the participants from participating in the study. And obviously all the players here, or all the participants rather, had informed consent on file. So that is a very quick overview of the introduction and method section. I hope that's helpful. You can obviously go back and read the PowerPoint, but hopefully this will aid a little bit in understanding. So hope you guys have a great rest of the day.